Dental assistant turnover specifically is upwards of 30%. One office may have SOPs, but then the next one does not. There's no consistency because, once again, we learn from each other.
Yeah.
And so I took those bad habits into my new practice.
Learning from each other can sometimes be a little tricky.
It's such a hard learning curve for them. It's so difficult. We want to rely on that SOP as the guidance or the learning Bible, if you will.
Okay.
So everybody's on the same page.
Well, let's talk about the importance of establishing SOPs and what are some of the compliance risks in the practice if you don't have those SOPs established. Hey everybody, it is Kevin Henry, Editor-in-Chief of DrBicuspid.com and founder of Dental Assistant Nation. So glad you joined us for what's going to be a very important podcast. And I'm thrilled to have on a dear friend and one of those influencers out there, Sherrie Busby. Hey Sherrie, how are you?
Hey Kevin, I am fabulous.
I am so glad to have you on. It's always good to talk to you.
It is good.
So let's talk about SOPs today. How about that?
That is such a subject near and dear to my heart.
Oh, good.
So yes.
All right. I can see the joy in your eye. Let's do this then. All right. Well, let's talk about the importance of establishing SOPs and what are some of the compliance risks in the practice if you don't have those SOPs established.
Well, the first thing would be, we can talk about the risk, right? So the risk would be that your team doesn't know what to do.
Yeah.
And then if you don't have something in writing, your new team members coming in, they don't know what to do. So we learn from each other. And if we don't have anything established that it's in writing specifically, then we learn our bad habits from our friends, right?
Yep.
Instead of getting the new ones. The benefits of that are just the opposite of what I said. So now you have everything is written down. There's no question about what is the procedure for doing anything within the practice, right? What is the procedure to do it? So when you get your existing team members that may need to have updated training, or you have new team members come into the practice, now you have something that you can say, okay, and there's consistency across the whole entire team.
So I've got to ask, we talked to existing team members, new team members. Are SOPs more important today maybe than ever with the turnover and everything going on?
Absolutely, because, dental assistant turnover specifically is upwards of 30%,
Ouch.
right?
Yeah.
That's a very high number. And so they go from office to office. So now one office may have SOPs, but then the next one does not. So it's such a hard learning curve for them. Right? It's so difficult. And there's no consistency because, once again, we learn from each other.
Yeah.
And so I took those bad habits into my new practice.
We take those bad habits. We say, well, we did it this way in my old practice.
Yeah.
And sometimes that can be a real issue. So that leads me into buy-in. How important is it to get the buy-in from the team to make sure that those SOPs are followed and really the law of the land? It's
so important because you can have it down on paper. Just like any law, you can have something there, but people have to understand what's in it for them, right?
Yeah.
And what is this law doing to protect myself, my team, and my patients, right? So they have to understand all those practices. Once they have that understanding and the what's in it for me part, it's a lot easier for people to be compliant, right? Because they have some buy-in. And also, if you include your team when you are developing SOPs, let them have some input into that because they're the ones doing that job. So they know what to do, right? So if they have some input, then your buy-in from your team is exponentially higher than it would be if you just give somebody a piece of paper and say, just do this.
So when we talk about input, is that something that happens often or are SOPs kind of locked in for a certain period of time? How do you kind of view SOPs?
I view them as a living, breathing document.
Okay. All right.
Keep them in a Word copy so you can update and add whatever you need to do, right?
Yep.
Because you may get a new product. You may get you may have a new service that comes into your practice. You may learn You may learn to do implants or something and you don't know what
Yeah.
it is. So you have to have these things that are very fluid. By law, by OSHA regulations, they should be updated at least annually,
Okay.
right? But I'm a proponent of every time there's a change, you pull those things out, you look at them, you review them with the team and make those changes.
So you mentioned products, and I'm curious about the relationship. Whenever you bring in a product, how much should it reflect your SOPs, and how important is it to kind of have that synergy?
It has to be things that are easy, right? The products are so important to be named in the SOP.
Okay.
Okay. Let's talk water because we're
Absolutely.
here with
Let's do.
Stericyl, right?
Absolutely.
Let's talk water. So I'm at Office A and they're using one set of products, and I come to Office B now and they're using Stericyl products, which by far are the easiest to use, right? Why wouldn't they?
Of course.
But so the person that's used to using other products doesn't know how to use Stericyl. There has to be training,
Okay.
right? And because we learn from each other, we want to rely on that SOP as the guidance or the learning Bible, if you will.
Okay.
So everybody's on the same page.
And the learning, I know learning from each other can sometimes be a little tricky. Shall
Always
we say?
tricky.
Yeah, exactly. So how's the best way that we learn in conjunction with the SOPs?
Well, I think that every team member, existing or new, should read the SOP. I know people are they're going to say, are you kidding?
That's like
you
reading
want me
the
to read
AFUs.
something?
That's crazy.
Right? That's
Yeah.
just craziness. But it lays out exactly how you do it in your office.
Okay.
Right?
All right.
Because dentistry is dentistry, but we all have our own little flavor to it, right? And so it shows how to do it in your office, such as using the products that work together, right? So if you choose, I'm a big proponent, I'm just going to say this, I love me some Citracil and some Fast Check 15 and the straws. Those are worked together so much easier than other products do, right?
Got it.
And so that learning, if you have something that's easy to start with, it's easier to teach.
Good. So protocols and SOPs. Tell me about the relationship there and what do we need to know about that?
Well, your SOP is your protocol. So, right, you're going to...
There you go.
There you go. You're going to write it down. And let's just we'll stay on our water topic here, right?
Please.
Because I'm so passionate about that. So we're going to write in our SOP that we're going to use our product, Fast Check 15, every month. And then this is how you do it. You take a pooled sample or you do a single line, whatever you need to do, right? Well, however your office has chosen to test. But you do that every single month. You write that in your SOP. That's the first direction. Then you can say, okay, now the next part of that is we need to just shock. So we're going to say we're going to shock. We should shock every month, right? We should run our shocking. So you're going to have to write your SOP like we're going to shock on Friday afternoon, leave it to the weekend, and then express everything or purge everything on Monday, right?
Yep.
Or you can say, oh, we work over the weekend, so we're going to do it on Tuesday and Wednesday, right? Leave it overnight. You can leave that stuff up to 2 weeks, so you've got a lot of flexibility. Therefore, your SOP can have lots of options, right?
Nice. Yeah.
You have options to choose from. Then the second thing is how do we treat? Right? So once again, love me the straw, right? I love the Stericyl straw. So you can say, we're going to use the Stericyl straw. This is how often we need to change it. It recommends to stay for a year, but maybe you're a very high volume office. You may need to change it more often, right? But you want to write those things down. And when you write with a product, then you know that that's the product that you've chosen to use in your practice, and it will carry forward through all of your team.
Let's play word association.
Go.
When I say silver, what do you say?
Oh, Stericyl.
Oh, there you go. See, look at that.
Enough said, right? I love how the products are all silver-based, which is the best cleaning agent that you can get, right? It's even gone to NASA. I mean, if you guys didn't see that article, it's really cool that it's in space. But it's so easy. They're so easy because they're so compatible. So if you choose to use, and you should choose to use, the Safe Water solution from Stericyl, you will be covered completely. It's easy. There's no guesswork, and it's so easy to train your people.
And whenever we've talked today about no guesswork, easy, SOPs, all those things just come together.
They do.
It's a beautiful thing.
It is a beautiful thing. And having it written down, I know people don't like to write anymore. I get that.
It's weird, right?
It is weird, but having it written down in an order that people can refer back to at any given time.
Well, Sherrie, as always, I appreciate the time. Thanks for being here.
I appreciate being here.
Absolutely.
So thank you.
Always good to see you, and always good to share some knowledge with all of you. Thanks for listening to this episode of this podcast brought to you by drbycuspid.com and Dental Assistant Nation. We'll be back soon with more thoughts on how your dental practice can stay safe and make sure your patients are safe as well.